Hello and welcome everyone. Thank you very much for joining us in today's webinar, Multiple Sclerosis and Work, Individual Factors Impacting Employment Status. My name is Elizabeth White and I'm the team lead of Learning and Development with the Work Wellness Institute, and I'll be helping to host and moderate conversation today in our session. I would like to start by acknowledging that I have the privilege to live and work on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Squamish, Tsleil-Waututh, and Musqueam nations. We would like to take a brief moment and thank our academic team and our 9 founding partner organizations in the Harnessing Talent project. Harnessing Talent Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges is a multi-year project funded by Employment and Social Development Canada. This webinar is made possible through the support of ESDC, as well as our memberships to WWI. And we also like to thank our advisory committee and of course our speakers who contribute to this webinar series. Just going to take a couple minutes right off the top to talk through some housekeeping notes. So hopefully at this point you've been able to hear me and are able to see kind of our presentation slide up top, either through that computer speakers or if you've chosen to dial in today, the conference call line that you've chosen. If you are experiencing any technical issues or if you might have any questions about the webinar topics, anything like that, the question box, which you'll find in your GoToWebinar panel that should be showing up on your screen, that's your main communication portal with us today. So please don't hesitate to submit any questions you have of all types, technical, topic, just overall WWI questions, anything you need, and we will get to them. And again, specifically for the Q&A session that we will have time for today, that will be where you can submit your questions. If any questions might be coming to the top of what happens after today's session, I'll just point to that now. So there will be post-event communication sent out to you. That's inclusive of presentation materials, the recording link of today's webinar, as well as if there are any questions we run out of time for, we'll get those answers in that post email as well. And you can always find the recording on our website too. Quick note to our members, for our organizational members, a reminder that your certificate will be provided to you automatically, and of course no charge there, as long as you filled in that record ID at time of registration. And to the individual WWI members, again, your free certificate will automatically be sent to you after this webinar presentation. On to the main event for today. We're very excited to have Dr. Lauren Strober with us today. Dr. Strober is a senior research scientist in the Center for Neuropsychology and Neuroscience Research and director of the Positive Health and Wellbeing Laboratory at Kessler Foundation. Dr. Strober completed her doctoral work in clinical psychology at the Pennsylvania State University and further completed a postdoctoral fellowship at the Cleveland Clinic in clinical neuropsychology. Her research focuses on identifying disease and person-specific factors that influence health and well-being among individuals with neurological or medical conditions, particularly focusing around multiple sclerosis, today's topic, or short form MS, with the forefront of her research being about improving the care for individuals with MS and assuring that they can live their fullest lives possible. So once again, thank you so much for being here today, Dr. Strober, and I'm very happy to turn things to you.
Wonderful, thank you. Thank you for having me, and I'm really excited to share not only my research, but also just a lot of sort of hopeful tips that people in the audience can use while kind of working with people with MS. So let me just get this. So just to kind of go over a brief overview of what today's talk will be. The first is I will speak about what are some of the factors predictive of unemployment in MS, then talk about some of the outcomes associated with unemployment. And then, this last part, which I think will probably be the most helpful for many, is what individuals feel has helped them either stay employed, or also what are the greatest barriers to staying employed and where we need to intervene. So employment serves as a proxy for issues critical to patients' perceived quality of life and well-being, and MS clearly has an impact on employment. Physicians and others providing healthcare to people with MS should routinely ask about employment and support thoughtful decision making about employment status. This was a quote back in 2005, and I think it's something that we really, as clinicians, didn't always give a lot of thought, even though most people are diagnosed with MS in the prime of their careers, of really being more thoughtful and deliberate in asking the questions early on about how will you have to maybe adapt your work, or think about in the future, how if MS, progresses, where would you be and how would that affect the work that you do to kind of keep people from being sort of underemployed too. And so it's really kind of our job to really begin asking these questions early on, I think, before it's too late when somebody's already needing to think about leaving the workforce. And this is another, really great quote. This is from a large survey study that I will be showing you guys that was conducted in 2016. But on World MS Day, we're reminded of the cost that MS imposes on those with the disease, on their families, and on a society as a whole. The report published today shows that loss of employment is the most significant factor in these costs. This is an area where we can make real progress with the cooperation of government, employers, and people affected by MS. So, this is a much more global issue. It's not just getting down to what does each individual patient need to be thinking about early on. And I know there's a lot of shock and awe with the diagnosis, but to even start having these discussions then, but that's helping the individual. But even on a more systemic level, whether it's employers, policymakers, MS organizations, which we'll get to at the end, everybody needs to be kind of on board and recognizing that this is something that needs to be at the forefront for people with MS. So let's give a brief overview on what is the status of unemployment in MS. So again, as I was saying, 90 to 96% of individuals are employed prior to or at the time of their diagnosis. Again, it being a prime time of their life and their careers. However, it's estimated that 24 to 80% of individuals are employed, and in general, across the board, only 40% are employed. But more striking is that 70 to 80% are unemployed within 5 years of diagnosis. Now, this was one statistic. I'm going to show you guys some more data, but you might want to say this is more between 5 and 10 years. But regardless of even that, it's really striking, as when you think about MS, the majority of people have a relapse and remitting course early on and don't necessarily have a significant level of disability that would preclude them from working still at that time. So the question is this sort of more of a reaction, a shock, again, of people feeling that they can't handle it right then? And that's, again, the idea of why early intervention is so imperative. So just to give you a perspective too on this, it hasn't changed much. So this was 1965. Bauer et al. Talked about sort of the prognostic criteria, what's the prognosis for people with MS? And at that point, it was fairly grim. And you can see here that only 70% were employed. I'm sorry, 70% were unemployed by 10 years. So only 30% were still employed at 11 to 15 years out of their diagnosis. And this was 1965. This is a large survey, again, done by the MS International Federation, who did the study in 2016 that I will reference. But in 2010, if you look at this pie chart, you'll see that 75%, so 47 within 3 years, but 75% within 10 years, leaving only that little 11 and 14 in the corner of 25 of people that were still working past 10 years. So that's really, again, extremely low when you think about the characteristics of the people who are diagnosed with MS, the age that they are, and where they might be with their careers. So several factors account for this decision to leave the workforce. This has been my sort of research for the past, 10 years or so, is trying to really identify what are those factors, and the fact that maybe some of them, like I'm saying, particularly early on, may be amenable to intervention, and what can we do? So with that said, we're going to take a first poll just to get a sense of what people think are the factors, or the primary factor, that may lead people with MS to feel as if they can no longer work. So I will hand this over.
Yes, the poll has just launched, so we'll just wait as people take a quick moment to respond. So I'll leave it open for a few more seconds here, as we've got almost a majority have put in. So just leave it open for a little bit as answers keep rolling in. Okay. So let's share the results. So what we're seeing here is a good 44% of our audience today is thinking mobility issues are the primary reason. Another split, 44% exactly, are thinking fatigue is the primary reason. And then on the lower scale, we have 6% each again, cognitive problems and muscle weakness.
Wonderful. All right, so you guys are all pretty much on to me here. I am surprised though, well, I shouldn't say I'm surprised because we know that cognitive issues are incredibly common in MS, but in general, people don't. It's probably only until the early 90s that physicians even gave more credence to the fact that cognitive issues occurred in MS. But it's actually cognitive issues, as we'll show, have a little bit more of a greater impact on why people feel they need to leave the workforce. But many of you, the 44% that said fatigue, you were correct. That is actually the number one, the biggest culprit as to why people leave the workforce. But we're going to look at this in greater detail now. So again, this is back to that 1965 study, and I like giving this look of studies over time to see how things have changed, because we would expect that things would change somewhat with the advent of all the treatments that there are available for people with MS. And we'll see that that comes up later on as to what's helped people stay employed, which is the medication. But what people are saying as to why they left the workforce really hasn't totally changed too much over time. But you can see here, certainly in 1965, the primary reason was spasticity, which is something that we do have better symptomatic treatment for, which is why maybe we don't see that as much now. But disturbances of coordination were high, and bowel and bladder were the most frequent of our primary, secondary, and tertiary. And again, this was 1965 in a study in Germany. This is sort of a overview of studies that were done then in 1980, 1985, 2003, and 2007. Here we see obviously that fatigue, again, rates as high as 79 to 70% were the number one, and then sort of the weakness, so upper and lower extremity problems, which you could put mobility in this. And we see here that anywhere from about 40% to 55% are reporting that that was the primary reason. And probably a little bit, for about 30 to 40-ish%, we see things such as balance or dizziness, heat sensitivity, which is really an important factor, believe it or not, and bowel and bladder problems. And so that's across up to 2007. In 2000, and then cognitive difficulties kind of comes even above those factors at about 35 to 36%. But this is now in 2016, and what we see is fatigue still remains the biggest reason for why people need to leave work. But we do have difficulty walking, standing, bending, moving around being the second. Weakness is the third, and that cognitive impairment sits right up there at 36. And then general worsening of their MS and some fine motor things being about 30% of the reason. And pain and bowel and bladder kind of coming in at a moderate level around 30. So in conclusion, we know that with regard at least to MS symptoms, fatigue is the most prominent factor for why individuals leave the workforce. This is followed by mobility issues, upper and lower extremity weakness, and cognitive issues, and that pain and bowel and bladder problems are also accountable at a moderate rate. So with this being said, so I'm going to give you guys another sort of timeline. This goes back to what I was showing you is that 1985 is when we started seeing a lot more attention given to employment in MS. This was probably the most seminal study on employment. It was Nick LaRocca, who was also actively involved in these larger surveys I'll be presenting. But this is sort of what I always use as my benchmark as where did we start with looking at employment issues and where are we now? So in 1984, they had 312 individuals, 77% of which were unemployed. And they just compared people who were working and not working, and they found that those who weren't were found to be more disabled, they were younger, less educated, and a higher proportion of women. And when they put this all into a model, right, so we do these regressions where we kind of want to figure out how much of this pie we can account for, those disease and demographics that I just showed you, variables, only accounted for 14% of the pie. So that leaves 86% unexplained. And this was sort of what I took as my setting point as to we need to figure out what that other 86% is. So we've been doing that over time. So this is a study in which we looked, this is in 2013, so nearly 30 years later. And we looked at 77 individuals. Again, 52% employed, 48 were unemployed. They completed the multiple sclerosis functional composite, which gets at cognition and physical impairment, and a neuropsychological test battery. And what we found was similar to what was already shown. Unemployed individuals had a longer disease duration and were more likely to have a progressive course. There was no differences with regard, so if you look at the top 3 lines, you see no differences with regard to gender, age, or education in this group. But then when it comes to that mobility, so the 25-foot walk and the 9-hole peg test getting at both that upper and lower extremity, we see that there were significant differences. So greater upper extremity difficulties were among the unemployed, and the trend for lower extremities. That cognitive test they gave, part of that the MS functional composite is the PACET, and there were no differences. On cognitive testing, though, we see that individuals who were unemployed demonstrated more impairment on measures of processing speed, learning and memory, and executive function. I should highlight here, processing speed is the #1 impairment among people with MS. You will always find a large effect size. We use this SDMT, which you see highlighted in that box in that first line. It is consistently, it's probably the one test you could use to differentiate people from working and not working. It's very sensitive, and it picks up a lot of what is probably affecting people in everyday life. And then after processing speed, learning and memory tends to be the most common impairment in MS as well. So these two together really do account for a lot of the reasons why people struggle to work, but they are also the most common factors, cognitive factors in MS. So again, thinking later on, when we think about what helps people get back to work, that processing speed, right? So that's your ability to kind of do things, online at the same time and do things effectively and fast, while maybe your efficiency, your cognitive efficiency. And then obviously learning and memory, we all understand. So how do you help people get over some of those cognitive problems while staying employed? So when we looked at all that, we again put it in a regression where we're trying to figure out how much of the pie we can account for. Only processing speed. So again, what I was saying, that SDMT is a really sensitive measure and predictor of cognitive status, and then ultimately employment status. But that accounted for 20%. So we're getting a little bit better. So if we look at that, it kind of makes me change my mind and think, well, maybe we need to give more attention to these factors. But what we see so far is that in the orange, sort of certain demographics, so an older age, less education, female gender, used to be what we thought of as being a little more predictive of possibly leaving work. Having a progressive course or greater disease severity, those disease variables highlighted in purple, and then the symptoms, so fatigue, cognitive difficulties, and mobility and weakness. So these were, when I entered the scene, this is what I understood as to why people weren't working. And then I said, well, let's try to still see if we can find more of that pie. So here was another test, but this time we also had cognition, and but we added a measure of personality. And what we find is, again, in this, there were a higher proportion of men actually in the unemployed group, not women. And on those disease variables, that yes, greater neurological impairment, a longer disease duration, and a greater likelihood of having a progressive course was more likely to be found among those that were unemployed, as well as greater reports of fatigue. And on cognitive testing, same significant findings. SDMT and SRT is a learning and memory task. That measures of processing speed and learning and memory were more impaired among those unemployed. But also that this personality, there was a persistence, which is sort of it's conscientious, basically. That personality added an additional 4%. So now, we're back up to explaining a little bit more with personality in there. And we can talk too about why that fits in. But basically at that point, we could say that demographics and disease only account for 14 to 21, and that there are certain demographics, disease variables, and fatigue and cognition that affect employment status. But we still kind of feel like there's other factors. So we are presently researching those. So such as personality was the first one, but now we're also going to look at coping. So this was a sample just of women, and we asked them why they left, fatigue being number one, followed by mobility and cognition and weakness. And we compared those that left to those that were still working, and we see that the unemployed individuals were older, consistent with what we think. Again, they had a longer disease duration, they have a greater level of disability on the EDSS, that they were more likely to have a progressive course. So you can see the 12 primary progressive or progressive versus 5 in the employed, and they reported greater fatigue. So no surprises here, and they performed worse on the SDMT. What was more interesting to me was we gave them a really lengthy measure on coping, and we find that those that were unemployed also reported a greater level of behavioral disengagement, which is sort of an avoidance means or emotion means way of coping, which we know is maladaptive in MS or in general in life, and also using a substance as a means of coping. So there's some, shedding some light here that we have sort of this personality factors, we have coping factors, and should we be giving them more credit? Now, those two studies were kind of my first soiree into looking at this. So as you could tell, we were only looking at one factor at a time. It was kind of using existing data that we had, because you're kind of diving in and asking these questions initially. But then when you can actually design a study and say, all right, well, I want to actually start really looking at these variables. So that is what I did. This was a NIH-funded grant for 5 years, and the interesting part was, or the novel part was, it was a prospective longitudinal study. So up to what I've just shown you of my work, it's always been that we ask people retrospectively after they're out of the workforce, and then we would compare them, and which I'll show you later on. That's not helpful because there are other things that happen when people become unemployed. So to say that that's what led somebody to MS to think they need to leave the workforce isn't really accurate, right? Because it may just be an artifact of simply being unemployed. So it's really important to catch people at that decision of whether or not they think they're going to leave the workforce, and then compare them on these variables if we do in fact think that it's not just the disease, but that there's a host of person-specific factors that we should be attending to. So this was my first, this is very, the first 20, I guess, or 50 people we had in the study, or 40. So we had 20 people that were considering leaving. That's what we call them, were at risk. So we would ask people, do you think that you're going to need to leave work in the foreseeable future? And we gave that as like a year, 6 months to a year, because of your MS. And then if they said no, we said, okay, do you think that even despite your MS, you're still at this point able to stay in the workforce? And those were our staying folks. And what we found, so again, like when you do design your own study, and you can look at this all together. So we gave measures of coping, personality, anxiety, self-efficacy with regard to just general self-efficacy, as well as MS-specific self-efficacy, how people feel they can manage their MS. And what we find is individuals who were considering leaving or feeling at risk, they did again endorse more maladaptive coping of behavioral disengagement, and also that they used less, or the people who were staying employed used more, let's say, humor. So this is a means of coping that's a little bit more adaptive. On personality, they reported individuals that were leaving reported greater levels of neuroticism and lower levels of extroversion. This is really significant because this is what we have coined the type D, or distressed personality. And we know across the board that individuals that fall on this tend to have just a host of worse outcomes with health and functioning. And we have also looked at this in greater depth as to how this affects people living with MS, not just with regard to employment. The individuals who felt they were at risk reported significantly greater both state and trait anxiety, lower general self-efficacy, and a lower sense of self-efficacy over managing or controlling one's illness. So, some people say, well, this sounds really dire, and now how do you really intervene? And if, we're looking at these, personality and coping and self-efficacy, these seems to be such, significant traits of a person. Are you really going to change them? And in fact, we do. And that's why we study this, because these are all avenues in which we can intervene, and it's important too. So what's nice about this is that when I put all of these items into my model, so we have fatigue, but we also have humor and behavioral disengagement or coping, we actually find that now when we go back to that pie and we only had 14%, now we can account to up to 44% of that pie by bringing in these person-specific factors, not just looking at demographics or MS variables. And so what that does for me is kind of change the landscape a little bit of this model, saying, well, maybe we need to add these person-specific factors in a more comprehensive way when we study MS and address both simultaneously. All right, so we're going to kind of go to another gear here of saying, well, why is it so important to identify these causes of unemployment, and why do we intervene? And I think it's really because we know the poor outcomes that can come with leaving the workforce and the benefits of staying employed. So with that, we'll go to our second section and we will do poll 2.
Okay, just about to launch our first true or false. So for this one, where we have, again, our first true or false, in general, mental health concerns decrease following leaving the workforce, we have about 9% thinking that that is a true statement and 91% thinking that is a false statement.
Is there a second question for that one?
Yep, the second true or false. Let me do that one now. So second true or false is up. And again, I'll just wait a moment as answers come in. Okay, so for this one, in general, individuals' health improved following leaving the workforce. So again, same split, but different. So 9% says true and 91% is saying that is a false statement.
Wonderful. So I think the audience is all on to me about this. I think in general, people have thought, well, when I leave the work, that's where all my stress is, and that's what's kind of the biggest stressor in my life. And if I leave work and I don't have to deal with this, and maybe even there were times where neurologists would actually tell patients, you need to remove all stress in your life. So if work is your greatest stressor, you need to leave work or find different work. It is a false statement. We know that there are significant mental and physical health outcomes associated with leaving the workforce that are not in the direction in which we want anybody to go with or without MS. And so I'm glad you guys were all on to me about that. And let's look at that. So we know that unemployment gravely impacts overall quality of life. There are many silent costs of unemployment, such as poor overall physical health, that actually even within 6 months of leaving work, people report greater cardiovascular disease, increased mental health problems, depression, anxiety, sleep disturbance, which again, if you're familiar with MS and the mental health aspects, these are already incredibly common. We don't need to aggravate it by being unemployed. There's an increased mortality and even a greater increase of suicidality. This was a study, again, done about a while ago in '84, where they followed people to see how work affected depression. And as you can see in the orange, that over the course of the year, people who were employed were the least depressed, whereas those that were unemployed were more depressed. But that people who became employed in that year reported lower depression, and those that became unemployed reported greater depression. We know that even going back to employment, we see increases in physical and mental health. that being engaged in the workforce, particularly among women, results in increased confidence and self-esteem, which is important when we think of the demographics of people with MS, and that individuals with MS view their work as important to their identity, self-esteem, and social contact, with many viewing it as therapeutic. So individuals also view work as important to their identity, self-esteem, and social contact, with many view as, quote. This is some quotes from this qualitative study that I don't think about being tired when I'm at work. My mind is too busy to think about my legs hurting. That's the best reason why people should work. You forget about the MS. If I'm home, I get really depressed. If I make myself get up and go, I feel better. Lying in bed and thinking about everything that's going wrong makes me feel worse. And that 40% of unemployed individuals with MS report wanting to return to work, stating that it's also a way of being part of society. I want to do a good job and be valuable and worthwhile. No matter how hard you try, a lot of your self-esteem is based on your work. You have to realize that you need to be part of society. If you lose your interaction with people, your world is going to shrink. So these were, again, part of the themes in this qualitative study that they did looking at employment in MS. And, just in general, we know that much of our esteem and identity is through work. One of the first questions we usually ask people is, oh, what do you do for a living? So it's not just about staying employed. It's really about our self-actualization in the grand scheme of it, that we know that we find so much through what we do, through work, through volunteering, through raising a family, whatever that is, giving us a sense of purpose and meaning in our lives. So again, as I mentioned, we've been conducting that first prospective longitudinal study on employment, and we asked people if they felt they needed to leave. They completed a host of questionnaires, and this was some initial data that we had, that within the first year, 14 individuals did in fact leave the workforce. Of those, 9 were of the ones that said they were at risk for leaving, but actually 5 who had told us at the onset of the study that they didn't, actually left. So we took these 14 individuals and we compared them to another 14 who were staying employed. So we matched them on gender, age, education, disease course, and disease duration. So we're leveling the playing field when it comes to demographics and disease factors, so that we can get a better sense of what else might be accounting for this, and also to see what the ultimate outcomes would be once they left. So we compared those that were working to those that left 6 months later, and we wanted to see what were the outcomes of them leaving. As you can see here, there was actually greater reports of fatigue from baseline to 6 months among those who were not working, as highlighted in the purple line. They had significantly more depression. This is vegetative symptoms of depression, so this is more about sleep disturbance and fatigue than sort of mood, which is what we just showed here. They had more anxiety, a trend for more anxiety. And the personality, which remember I mentioned earlier, this type D personality of high neuroticism, low extroversion not being helpful. They reported less or declines in extroversion over time. And more harm avoidance, which is again another measure of neuroticism. So they're showing greater increases in that, and also greater increases in poor self-efficacy, which are also part of neuroticism. So with this, we can kind of already see that even just a 6-month period, individuals who left the workforce began endorsing greater levels of fatigue and depression. They also reported greater levels of harm avoidance and lower levels of extroversion, which is akin to this type D personality, as well as perceived low self-efficacy, and that there was a trend for increased anxiety. So inclusion of these last, first 2 sections I've shown you, what I'm hoping people understand is that we know that unemployment is associated with a host of negative physical and mental health outcomes, that assisting individuals in maintaining their employment is a priority, particularly in that 5 to 10 years following diagnosis, and that there's a host of disease and person-specific factors that account for it. And again, medication can do as much as we can in dealing with the disease symptoms, but there's so much of room for intervention through psychological interventions, wellness interventions, just MS management with nursing care to deal with some of the person-specific factors. So with that, I will be into our last section of today, And I believe we will start this section with a poll as well.
Okay, great. I will get that going. That poll has launched, and it's also a great moment just to say we're about 10 minutes until we'll move into Q&A. So the poll is open, and as our votes are coming in, I'll leave it open for a few more seconds here to get everyone's thoughts. A couple last ones have snuck through, but I will close it now and share. Okay, so with this one, what do people with MS report as being the greatest factors hindering their ability to work? There is an overwhelming majority, 80%, saying lack of support from employers and or coworkers, with 15% thinking it's the unpredictable workload, and 5% thinking it's poor access to transport or parking. We got no results coming as lack of time off being that greatest factor.
All right, so this is great news in some ways of everybody recognizing that, yes, the lack of support and knowledge and education by employers and coworkers is certainly in the top three. But as we'll discuss and highlight later, actually the unpredictable workload is a really significant contributor. And for some, it was, well, in one study was listed, poll, it's listed as number one. And we'll discuss my theory behind that because I think it's really important. And it was something that I was surprising to learn myself. And I think I came up with a hypothesis why it might be. So we can discuss that in the next section. And I think there's another question.
Yep, so let me just share that last one there. So that's now live, so please feel free to vote as I hold it open for a few seconds. Okay, so sharing those results. So a little bit of a flip side, what do people with MS report as being the most helpful in staying in the workforce? So we have half, almost, well, more than half, 55% of our audience today saying supportive and educated employers and coworkers, with the second most, 35%, being flexible work hours, and then a minority of 10% with adaptive aids and computer adjustments, and again 0% for that last option of periods of rest.
Right, so the audience has gotten this right in some ways. Yeah, adaptive things and computer aids and all that has not been the biggest help, which is good to know when you really think about, you know, vocational specialists or really don't, or vocational therapists, they're not as versed in working with MS patients. This is something we're really working on to try to figure out how we can implement this better. But you might think that they would do similar things that they might do with somebody with a TBI or SCI or something like that, but that the aids actually are not the biggest help. But the flexible hours is one of the biggest, and the periods of rest, which I'm surprised nobody thought that, because it's sort of intuitive when we think if fatigue is the biggest culprit as to why people aren't leaving, then maybe if they could just have periods of rest or find ways to manage their fatigue throughout the day, we would see that they can stay employed. But certainly, as I'll show you in the next data, support from employers and coworkers still ranks very high as far as helping people stay employed, and also the lack of which might lead to someone leaving. So this is the survey I've been alluding to the whole time earlier. This is a 2016. This was a global MS employment report. As you can see, several countries in which they collected this data on, and it was on about 11,515 individuals with MS. So I refer to this a lot. It's a great resource. I will at the end provide the links to both of these, the 2010 and the 2016 reports. This is just sound, really good work looking at employment issues in MS. So back to what we were saying earlier, MS-related factors that help people remain at work. So their MS being stable being the number one. And then if you look there, you'll see disease-modifying treatment and medication symptomatic treatments come in the third and fourth spot. So again, this I think changes the landscape as to with the advent of so many medications and also symptomatic treatments, we have treatments for even fatigue now that we didn't have years ago. So that would be the first sort of avenue, right? Is making sure that we can get their MS stable enough that it's predictable and manageable, that they found a good medication that works for them, and that they can handle the symptomatic treatment. After that, it's seated work and flexible working hours and rest time during their breaks. And then that little 20%, and we'll use that as our cutoff, but having routine, predictable workload, which I'll get to in greater detail later. But as we can say, the aids and computer adjustments you see down there at the bottom at 5% and 7% are not the most helpful. But what are some of the support related factors that enable people to remain at work? Family support being the biggest. And again, supportive employer and colleagues, having a decent salary doesn't hurt, but also a lack of discrimination and a good awareness among their colleagues about what MS is. And then what affected people's ability to remain at work. So, this was a really interesting finding for me, but this unpredictable workload is the #1 predictor. But when we think about it, all the factors we're talking about, fatigue, processing speed, learning and memory, if someone's coming into work every day, having to navigate that, and especially their fatigue, and we talk to them all the time about, well, work to your strengths. So work when your fatigue is the lowest, and do all the things maybe that require a lot more processing or more brain power during that time or earlier in the day. So to manage your symptoms throughout the course of your day. But if we have unpredictable workload, then how does somebody know, like, I'm trying to use this sort of script to my day, but I'm being bombarded by things that are coming at me that are unpredictable or not as consistent with what I've already learned and established I could do in my workday to be more effective. So that's where I think, that's my hypothesis to why that comes up, is having more predictable idea of what's expected of you so that you know how to work to your strengths every day. But then that's also followed by, and this was in that survey, and you guys did a good job of recognizing that lack of support from employer and colleagues is very high, a lack of time off when needed. This is also really important with people who, after their treatments, and especially if they need time off for their infusions, making sure that we can assure more family medical leave or PTO or sick time, that people sometimes need a day after their treatment to kind of get back on their feet, or they need a day for their infusion, so getting that lack of time off when needed. And then that last, 2 here, we'll put, the environment. So I mentioned the heat sensitivity. So either being too cold or too hot. So helping people be in a more temperature controlled environment. And also the poor access to transport and parking. And I've heard this qualitatively from people in my studies who say, by the time I've commuted to work or I've walked from the parking lot to my office, I'm exhausted, especially on a hot day. And I'm already starting my day off on a bad foot. And getting back to that too, when I mentioned about having these conversations early on with patients, a woman who did in my study who ended up doing a speaking engagement with me, she talked about having plan A when she first found out about MS, and also a plan B and a plan C. But she was an attorney, and one of the first things she did when she found out she had MS was relocated to a place where she'd be closer to work, and that she knew she would also have easy transportation or could commute if by down the road she couldn't drive. So these are those conversations to be having early on, because if we know these are problems for people when MS progresses, how do we help them proactively get to where they need to be? And then finally, the factors where people say this would have helped me stay employed. So having flexible work hours, again, that rest during breaks, both having a time and a place to rest are important. Better awareness of MS among their colleagues, and support. And again, this routine, predictable workload, and being able to sit. So in summary, we know that employment is a significant proxy for quality of life in MS. It provides purpose and meaning, social support, self-confidence, self-efficacy, and greater overall well-being. It's associated with, being unemployed is associated with many silent costs, such as poor overall health, mental health, and even mortality and suicide rates. Predictors of unemployment are both disease-related and person-specific. So again, disease course and duration are always going to be a factor. fatigue, mobility issues, weakness, pain, bowel and bladder, cognitive issues of processing speed and memory, but also this role that we found of personality, coping, self-efficacy, and anxiety, and perceived self-management, and that we should consider both of these when helping our patients make decisions regarding employment status and address both. There are many accommodations that would help people stay employed beyond just having a stable disease and good medical treatment. These include, and I put these in kind of, sections, that this would be sort of more environmental factors, seated work and temperature control, rest periods in places, having an elevator, close parking and transportation and work areas. For one thing is, if patients will say, if I need to walk to the printer and it's on the other side of the building, I do that 12 times a day. Or if I can tell my boss I'm just going to go one time at the end of the day, or get the printer moved closer to their desk, can help a lot. Having flexible work hours and leave time, having routine and predictable work, and again, that support and knowledge of employers and coworkers. Recognizing the time, I will just go over these real fast. These were actually just pulled from that 2016 report, so people can find them there as well. But just to give some recommendations for employers, MS organizations, and policymakers. For employers, it's important to understand the nature of MS and ensure that the workplace is supportive, but also recognizing that it's different for everyone. So helping would be asking specifically what they need. It'd be helpful to have someone come in, a professional, a vocational specialist, to really assist with the accommodations, and also be aware that this can also affect not just the patient, but the person who's also caring for some. If you have an employee whose partner has MS, it could be affecting their work as well. For MS organizations, provide information for people with MS to help them explore their options to stay and know what their rights are. Encourage access to appropriate treatment, both, again, disease-modifying treatments as well as other allied treatments that help people specifically in the workforce, and provide people with information as to how they could educate their employers or colleagues about MS more specifically. And then obviously policymakers, which is above, many of us, but to ensure that there are laws that will really prevent any sort of disability or discrimination against people with MS, and that we require employers to make these adjustments when necessary. So these are the two resources of those two large surveys that I think if anyone needs more further information, they're really, a gold mine to go into. Just some acknowledgments. This work is obviously not done by me alone. I've had great research assistants over the past decade helping with this. And again, as I mentioned, this was funded by the NIH, the National MS Society, and the Patterson Trust. Thank you.
Thank you so much, Dr. Strober, for that very thorough presentation. Went through so many different great areas of knowledge. I'll just remind the audience that that questions box is where you can communicate with us so we can have some conversation to end our time together today. But I'll start things off with our first question regarding the pandemic that we've been living in, and has this impacted people with MS and their employment, whether positively or negatively, considering some of those flexible work kind of happened unintentionally with that. So just from the audience, a curiosity of how that may have affected.
Yeah, it certainly has. So a lot of patients I've spoken to, because we did do we followed up with the people who were in our initial employment study to find out how they were doing now, not just with COVID as well, but also their work status. And for many, many patients, they said it's been a godsend to them that they can actually now manage to even feel better about themselves, that they can get the stuff they wanted to get done at home, so they can actually still make a dinner because they're not commuting, they're not as tired by the end of the day, and they can kind of divide their tasks more throughout the day. So it's been, some people have said it's basically allowed them to stay employed, recognizing that this was sort of a fortuitous time in that regard, and that it changed their ability quite a bit. I will say though, we looked at what the rate of unemployment was, because we know that that's been happening, obviously following in there was no significant dropout of the workforce due to the pandemic among at least the people with MS that I followed up with.
Oh, wow, that's kind of an interesting factor
Yeah,
too, and potentially a little follow-up there. So things like hybrid or remote work or those kinds of flexible work, that seems to be something that could be, if it was permanent, perhaps something helpful to keep.
absolutely.
Okay. So the next question we have is what types of therapies have the greatest outcomes in changing those factors that you mentioned, such as the cognitive processing, thinking, personality, those kinds of things?
So we conducted, it was called the SEMS project, Staying Employed with MS. And from my data, what we did was a sort of comprehensive intervention. So we offered, the biggest one was doing a fatigue intervention. So we offered that. It was actually a fatigue intervention developed in the UK. And the premise of it is really improving self-efficacy, though. But through that,
Mm,
showing people that if you can, and all these interventions that and many that I do, we focus on self-efficacy first, because that's kind of the way in to dealing with managing symptoms. So we had a fatigue management and we had a wellness, which got at everything. So everybody got that. And then if they met criteria for any cognitive problems or depression and anxiety, they also received, an hour or 2 hours a week of cognitive intervention and psychological intervention. So it was sort of a modular intervention. So it's like not a one size fits all. It depended on where
right.
people were. But I do believe that that is the right approach to start with taking, is offering people sort of this modular intervention that gets at what they need most. But certainly, when it comes to improving like locus of control and self-efficacy and even personality, these cognitive behavioral interventions that have at the underlying principle improving self-efficacy and also bringing in some elements of positive psychology where we're trying to help people recognize how to find, like, refines in some ways their purpose and meaning in life, the importance of their relationships, and also expressing gratitude and feeling that they can see some sort of self-actualization despite their MS, and also that we really hone in on their strengths and how to work with one's strengths. And this is for anybody that, if you're spending your whole life working against yourself because you realize your strengths, rather than focusing on what your limitations are.
Yeah, I think that is when you're talking about personality, one of those things that stood out is the extroversion. And that's kind of something that you might have or have not. Like that's not maybe something that can be kind of taught. So just looking at that approach of where are those strengths you can work with.
Right.
Yeah, that's great. So this is a little bit of a different data question. So you may or may not have this at hand, but more asking around data to find the causes and even perhaps prevention of MS, the disease itself.
Yeah, that's beyond my scope a bit. We don't really, okay, so we don't really know what causes MS still today.
Right.
Um, but there's a host of factors. Even geographical location, where you were in the first 13 years of your life, if you had gotten certain infections as a child, vitamin D is a factor. And obviously there's a genetic component, but no one truly knows. We have ideas, but no one truly knows what causes MS. And unfortunately, still to this day, there is no known cure for MS.
Right. Yeah. And so switching into, as we talked about today, that awareness and education piece is so important to then kind of allow for the support from employers, coworkers. So in terms of that, do you have recommendations, resources, something to go to help start this conversation and start building that awareness in workplaces?
Yeah, so certainly I believe the MS Society, they used to, they've had a lot of funding. So, and again, this is in the US, the National MS Society. I don't know what it would be I know the Canadian MS Society has it as well. I don't know if they had this program or not, but we had, like, I think they were called employee navigators, and there was a lawyer that would work on that, as well, and then two vocational specialists. But they were at least when it was running, and I'm not sure if it is, but I'm still sure there's probably things on the web pages that would provide, I think, even a sheet or like a little info fact that you could help bring to your employer or your colleagues to kind of open up the conversation, as well as having the lawyer that was there that would help you kind of breach the topic of what are my rights, and how to discuss that with your employer, or have them even call your employer and go over what needs to be done. But one thing, and I'm sure that they probably have this through some of the MS Society, is having, even somebody from the MS Society coming in and doing sort of an in-service for your company to meet
Mm-hmm.
MSs.
Little lunch and learn, perhaps, opportunity to get that conversation started.
Mhm.
And I'll just end with a final question because we're just almost to the top of the hour, and then we'll close with some housekeeping. But just wanting to have a conversation around disclosure is something that's come up within our questions, because as we've talked about, seems like earlier the better to try and kind of get to these supports. So where does disclosure and that kind of conversation come into play?
Yeah, so this is a difficult question because it's very, very common for individuals with MS to not only be in their own sort of shock about it and needing time to digest it following diagnosis, but a lot of people conceal their illness, mostly due to a lack of awareness or knowledge of people around them, or they feel like the misperceptions of what MS is, or people feeling negative for them, or when it comes to employers, being fearful of, well, you know, they don't really know what MS is anyway, and they're not going
Hmm.
to really understand. Now they might discriminate against me, or if I start having mishaps, they'll think, oh, it must be my MS. So a lot of people don't disclose. When I'm asked this question, I usually tell people, A, you're legally protected to be able to work, and it's important to work, not just, it's just your livelihood and your well-being. And it's better to disclose when you're not having any issues than to having to disclose after you've already become that bad employee, because that's harder to come
Hmm.
back.
Hmm.
So people ask me on my professional and personal, I say there's no harm in disclosing it. They can't discriminate against you, but again, I can't control what employees and organizations do, unfortunately. But legally, they really can't. And it's better to get that in place so that you're, again, able to work to your strengths and not wait till a limitation is placed upon you and then asking for help.
Yeah, absolutely. And it just, I think, aligns so well to everything you've talked about today. And, those simple things like moving the printer, like all of those things can just kind of happen earlier and better so that hopefully there's a more positive outcome overall.
Absolutely.
Wonderful. Well, we are at the top of the hour now, so I want to thank you again, Dr. Strober, for being with us today, having this conversation with us, and even beginning that building of awareness just through our conversation today. And I'll just close for our audience with a few notes and reminders. So again, this presentation has been recorded. You will be provided that through the post-communication email, as well as you're welcome to find it through our WWI website and eCampus. Again, for our members, certifications will be provided for both organizational and WWI individual members. But if you do have any issues along that certification way, please reach out to membership services at workwellnessinstitute.org, as well as if becoming a member sounds like a great idea to you and to start getting those automated free certificates of attendance, again, membership services at workwellnessinstitute.org is your best source of information. We will ask that an evaluation survey is going to pop up for you as soon as we close today, and we greatly appreciate you taking just a few moments of your time to fill that in, as we do take all of that great data to help us and continue our webinar programming and ensuring its relevancy to our audience. Again, our webinars are created for public access and supported by memberships and funding sponsors. So thank you so much for your continued support. And please note that our full programming, webinars, our e-courses, all of our learning resources can be found in the courses section of our website. And then you can get all of the most up-to-date information. But I'll hope to see you all at our next webinar. That's actually next week on September 14th with Dr. Ellen Choi on equity, diversity, and inclusion in well-being and mindfulness. So once again, thank you to everyone for joining us today, as well as our wonderful speaker, Dr. Strober, and I hope everyone enjoys the rest of the day.
So, thank you again.